the sag, the jowls, the drooping, whatever you want to call it, if you have ever done this in the mirror, pulled back on your jawline after brushing your teeth in the mirror in the morning and wished it would just stay that way, you are not alone, my friend. Okay, I am Dr. Ray Hamidi. I'm a board certified dermatologist. Today I'm going to talk to you about sagging. What is it? Why does it happen? And what can we do about it? Is surgery your only option? I really want to get into that today, and I will tell you why in a moment. But first, why is sagging such a problem? Why is it such the bane of the existence of so many women? If you are in your 40s or beyond, chances are you have dealt with a little bit of jowling, of sagging, of deep folds. And so one of the reasons that I think it bothers people a lot is that it's one of the things that ages our faces the most. Wouldn't you agree? So even more than things like wrinkles or dark circles under the eyes, sagging, when you see that happening on the lower face, it can really age a person. Subsequently, I do think that for a lot of people, including myself, when they see that reflected back in the mirror, or in a picture, or on the Zoom cam, for example, and they are seeing that drooping happening, it actually changes the way they feel about themselves, the way they view themselves. And again, I will speak from experience here. I am 45 years old. I'm a mother to 2 young children. I had children late in life at the ages 39 and 41. I still feel young. I still feel energetic, full of life. I feel vibrant. I feel like a young mom, and I really want that reflected back to me in the mirror. And so when I see that drooping, that sagging happening in the mirror, which by the way, I have, and I did, especially after neglecting myself and my skin for years after having children, when I see that in the mirror, it really affects my confidence, how I carry myself, how I view myself. And I just don't want to view myself that way. I don't want to view myself as someone who is old because I just don't feel that way. Okay, so that is, I think, another reason why sagging is such a problem mentally, emotionally, and of course physically for a lot of people. Okay, so let's get into the real deal talk on sagging. And one of the reasons I wanted to talk about this today is that I recently saw a dermatologist online on social media, and I won't say who it was, but she did a reel kind of suggesting that if you are someone who does this, which by the way, I have done this several times in my life, kind of tugging back on your jawline and was saying, oh, I like that. If you're someone who does that, then you should just get a facelift because that is the only thing that's going to help you. So I had to respectfully disagree with that statement. I respect this dermatologist very much, but I don't agree with that statement. And so I'm going to get into in a moment what your options are. And first though, I want to talk about the cause of sagging. What actually causes it? Because when we want to know what we need to do to treat it, we really need to know what the underlying causes are. Okay, so sagging is caused by 3 main factors. The first is age-related and health-related reabsorption of bone in the bones of your face. Okay, so the bones of your face with time, with age, and with certain lifestyle factors, health factors, etc., thin out. That leads to loss of support of the overlying skin and more superficial tissues. Okay, so then it's allowed to droop more easily. Second is atrophy of the deep facial fat pads, and to a degree the muscles in the face as well, also typically age related, somewhat lifestyle related as well. And so similar to the bone reabsorption, that also leads to a loss of support of the overlying skin and more superficial tissues, which allows them to fall more easily. And then the last major factor leading to sagging is loss of collagen and elastin, which is totally normal and natural as we age. It just is a natural part of life. Of course, it can be accelerated by certain factors like unprotected sun or UV exposure and many, many different lifestyle factors and health factors. But that is another major one because I call collagen the scaffold of the skin. It is what gives skin its structure, and then elastin gives it its bounce back quality, right? So when you pull it and it bounces back, it kind of goes back to its natural shape. That is elastin working at maximum degree, okay? And when you lose that, gravity pulls and it does not bounce back. And so everything is allowed to droop a bit more. And so you can see that it is not just one factor that leads to sagging, it's several. And so that is why a combination approach is typically going to be your best, most natural looking approach to addressing sagging non-surgically. Okay, so by now you might be thinking, all right, Dr. Ray, I know I can do other things for sagging, you're alluding to that, but is surgery really my best bet? Should I just, bite the bullet and do surgery and have a facelift? So the answer to that is going to be dependent on one major factor, which is how severe the sagging is. And that is going to tell you whether surgery is really your best bet or if you can get a noticeable improvement with other non-surgical options, which we'll talk about in a moment. when you have mild to moderate sagging, and this is typically going to be for someone in their early 40s to, I would say, maximum early 60s. And that, by the way, depends on a number of factors, including your lifestyle and what preventative measures you've taken before, and definitely your age factors into it. I would say for those people in that category with mild to moderate sagging, you can definitely see a noticeable improvement with a combination of professional in-office treatments that are not surgical in nature. Okay, so what are those treatments? And remember that a combination is typically going to be your best bet for getting the most natural look and not looking like you are trying too hard, okay, if I have to say it bluntly. So the treatment options in office are usually going to be a combination of hyaluronic acid fillers and or biostimulators like Sculptra, along with tightening devices. And that could be in the form of radiofrequency or radiofrequency microneedling. If you are on the younger side, in your 40s especially, I really like it for that kind of skin. Or ultrasound-based devices like soft wave, all therapy, and even laser resurfacing can get you tightening of the skin depending on what type of laser and what the settings are. And the last thing that is going to be a big factor in terms of how much those other treatments are actually doing and how long they're lasting, etc., is a healthy lifestyle, okay? And I would say you are really counteracting all the in-office treatments you're doing and even really good home skincare if you are leading an unhealthy lifestyle. And but that can mean a lot of things, right? It doesn't really mean one thing, but things that I include in that category are, for example, eating a lot of processed foods, a lot of sugar, not managing stress, because everybody has stress in their lives, right? To varying degrees, some definitely more than others. And it's not really the amount of stress that you have in your life as much as it is how well you manage it. Are you allowing it to get to you, to get your blood pressure up, to get your heart rate up, and all the things, and get your cortisol up? And that is going to affect you more than someone who might have more stress than you, but is really able to manage it with techniques like meditation or breath work, etc., those kinds of things. So yes, lifestyle does play a role. Okay, so by now you might be wondering, okay, Dr. Ray, but what about face yoga? Because I saw a really convincing advertisement on Instagram that said that face yoga basically reverses jowling and sagging and definitely can prevent it. So is that the case? Let's talk about it, because if you are like me and millions of other people in the world, you have seen ads, you have seen posts, etc., YouTube videos, etc., talking about face yoga for sagging. So as a scientist, and I'm a scientist, but I encourage you as well to be a scientist, because in this day and age where everybody has a voice, anyone can say anything online, right? Instagram, YouTube, and so many claims are made. It is really hard to know what's true and what's not. And that's when it becomes even more important to look at the science, look at the data, look at what skin science tells us and what clinical trials evidence tell us. Okay, so with yoga, I do want you to know there is one randomized controlled trial. There's one that assesses the effect of face yoga on several different facial features, including sagging. Okay, it was done in 2018. It had 16 subjects, so that already tells you it's a very small study. The treatment was 30 minutes of face yoga daily for 8 weeks, and then every other day for another 12 weeks. So a total of 20 weeks, or about 5 months of face yoga exercises, okay? Fairly intensive. And so they measured beginning and after. They measured several different facial features that basically looked at the degree of sagging on a 4-point scale from 0 to 4, 4 being worse. And they found that out of 19 features that they looked at, 2 of them, which were upper cheek fullness and lower cheek fullness, did improve to a mild degree. So there was a less than 1 point improvement in both of those categories. 17 out of the 19 other features that they looked at had no improvement. Based on that data, I would say it's really hard to conclude that face yoga is very effective for facial sagging. So is it something that I recommend to my patients, to my clients that they do? It is not, okay? And it's not something I do myself either. And I don't actually know any dermatologists that do it, if that tells you anything. However, it is fairly low risk, right? Not much bad is going to happen, I don't think, except if you are moving those facial muscles a lot and making like really big expressions, you may be creasing your skin a bit more than you normally would, and that might actually lead to dynamic wrinkles that then lead to static wrinkles. Dynamic wrinkles are wrinkles that are made when you move your face, and they eventually turn into static wrinkles, which are there when you don't move your face. So just as someone who is very expressive, who like really speaks with their face, right, with the muscles of their face, just like they tend to get more wrinkles than someone who doesn't as much, or someone who has dampened those muscle expressions with a neuromodulator like Botox, etc. If you are doing face yoga and you're really, I have seen these exercises done, they're making really expressive faces and movements. So I guess the main risk would be that you would be getting more wrinkles as a result, okay? However, beyond that, it is really pretty much free unless you buy into one of these apps or programs or something like that. But really, you could probably YouTube it and see exercises on YouTube. And if you want to try it, I'm all for it. I will not ever tell anyone don't do face yoga, but I just would say go in with low expectations maybe, and you won't be disappointed. Okay, the next thing I want to talk about is topical treatment like peptides, retinoids, etc. for sagging. You might again be wondering at this point, okay, I see so many advertisements for anti-aging creams, retinol, peptides, exosomes, etc., that say things like increases firmness and elasticity of the skin. Or I've seen this for one of the colostrum products. It says, cancel your injectables appointment. Or one of the popular, very popular in the US, prescription skincare companies that I've seen advertise on Facebook and Instagram, showing advertisements of a before and after, which is, by the way, in like totally different lighting, etc., with a different facial expression. And the tagline under it is how I transformed my face without a facelift. So what is that doing? It is implying to women everywhere that you can get facelift-like or filler-like results with a topical anti-aging cream. Okay, so here is the real deal. As a dermatologist of 15 years treating aging faces, I can tell you that a few things. First is that topical treatments like peptides, retinoids, etc., absolutely in combination with the professional treatments we talked about, healthy lifestyle, can help prolong and amplify the results that you're going to get, okay? Number one. Number two, they can help, if you start them early on especially, slow down the aging process, including sagging. And remember though that sagging is also caused by volume loss. It's not just collagen and elastin loss. And of course, topical treatments can't really touch the volume underneath. So just, again, take that with a grain of salt. You cannot prevent sagging completely, even if you were using peptides and retinol since the age of 15, okay? And hopefully you're not doing that. Let's say you did. Let's say you started peptides and retinol at 15. You still are going to get the sagging. It is not just collagen and elastin loss. And not only that, but the topical treatments, they do help slow down collagen loss. They do help build collagen, but it is to a certain degree, right? It's not going to be like 100% effective. And then the last thing I want to say is no combination of peptides, retinols, exosomes, that $500 exosome bottle, or any combination of all of the above is going to lift your sagging or jowls to a degree where you are going to be happy when you look in the mirror if it's something that bothers you. Okay, it's just not. So I really don't want you to go wasting your money on those expensive products, even though they do have really good effects, and you're probably going to be using them anyway, but it's all about expectations. Okay, if you're using those products with the expectation that is going to do that, that it's going to lift your jowls, then you might find yourself jumping from product to product to product, looking for the one that's actually going to do that, because they promise that they will, right? But you don't have to do that. You could pick a really good retinol, a peptide, use them consistently as a preventative measure, as an anti-aging measure in terms of slowing down the aging process, not just sagging, but also things like fine lines, wrinkles, dark spots, all the things. And when you do it that way, when you do it in a preventative way, you're really much less likely to be disappointed. And the hard truth really is this, okay? Sagging is really, really difficult to improve to a noticeable degree, and almost always is going to require some sort of in-office treatment if it's already happening. If you're already seeing it in the mirror, especially if it is already to the degree that it is affecting your confidence or your mood or how you show up in the world, that you're gonna probably need some professional treatments to address it. However, it is not a one-size-fits formula in terms of what to put your focus on when you're addressing sagging, whether it is the lifestyle changes, the products, or especially which in-office treatments are gonna be best. It is dependent on a number of factors, including your age, your current lifestyle, your past lifestyle, including things like smoking, nutrition, stress, sleep, all those things, what kind of preventative treatments you've already done in the past, and all of that's going to factor in. But the good news here really is that no, surgery is really not your only or even your best option when the sagging is in a mild to moderate category, okay? And I know as a 45-year-old woman, I was seeing a lot of sagging that I really was not happy with. And again, this was due to a lot of neglect of myself, my skincare, my internal health after I became a mother 6 years ago. And there was zero chance that I was going to have a facelift at 43. Okay, it just was not going to happen. So I took the measures. I cleaned up my lifestyle. I cleaned up my nutrition. I went back on a really effective home anti-aging regimen. And very, very importantly, I invested time and money in in-office treatments. And I know it's easy to say that as a dermatologist. I have access to everything. Not everybody does, and I totally understand that. However, I will say that is kind of what is going to be required if we're trying to address jowling or sagging. That's what I did, and now I'm in a place where I'm super duper happy. I really have to search for my jowls. They're not so obvious to me, and I just feel so much more confident in my appearance because I took those measures. I took that action to address what was bothering me. Okay, so if you are wondering what you need for your unique specific skin situation, whether it's jowling or wrinkles, fine lines, dark spots, dark circles under the eyes, whatever it is, and you want more specific personalized guidance from me, that is exactly what we're doing in my new program, Radiant by Design. Inside RBD, you are going to get your personalized, comprehensive skin blueprint that is, first of all, rooted in science and skin science and not hype, right? It is backed by my 15 years of clinical expertise as a dermatologist treating aging faces. And it is all based on your unique skin, your concerns right now, and your goals for your skin, your lifestyle, all the things, okay? So if you are interested in that and you want to find out more, you can get on the priority list. This is your last chance because we are opening up doors soon. You can get on the priority list, leave a comment below in the comment section, and I will get you in. You have to get in before Friday, August 1st on the priority list if you want first access to become a founding member of Radiant by Design for 50% off. And this opportunity will not come again. 15 founding members, we're only taking 15. We already have hundreds of people on the priority list, the wait list. So if you'd like early access, be the first to get in, not miss out, leave me a comment and I will get you in. Okay, so I hope that was helpful. I want to hear all your questions about sagging because this is one of my favorite topics. Again, personally, it has been one of the things that has really bothered me the most about my skin. And so I am very passionate about this. Okay, so I hope that was helpful. And I would love to hear from you too. Have you dealt with sagging? How does it make you feel? Have you tried anything for it? Has it helped? And if you feel like you've tried a cream for sagging and it really helped, please tell me. I really want to hear about that. I want to hear about your experiences and your questions, okay? So if you have any questions, drop them in the comments. I would love to answer. All right, so that's it for now. I hope you have a great day and I will see you next time.